Good evening, colleagues. It's evening time here in Melbourne, Australia, but I realise that many of you will be viewing this lecture at other times during the day, in the morning or the afternoon or the evening. So perhaps it's safer for me just to say good day to all of you and welcome to this lecture. It's wonderful to be looking forward to meeting all of you virtually in the coming days, and then in person in the coming weeks. So that's going to be very exciting. So welcome to this first lecture, which has the title Implementation Science and Interventions at Scale. What's the connection? Overview of the lecture. I'll talk about implementation and scale-up versus researching and studying implementation and scale-up. I'll talk about similarities and differences between implementation science and scale-up science. I'll talk about some of the relevant concepts and considerations from the field of implementation science, many of which most of you will probably already be quite familiar with, and then I'll talk about some further considerations and other issues. So, the first point about doing implementation versus studying implementation. So implementation refers to the act of putting a plan or an idea or an intervention, a program or a service into effect into a real world context, community, health service or setting. Implementation science is the study of the methods and the strategies to promote the uptake and implementation of evidence-based interventions into routine practice or into a real-world setting. So implementation focuses on the act of putting something into practice, while implementation science and research focus on studying how to do this, how to do it effectively, how to do it efficiently, cost-effectively, and sustainably. Implementation is a specific action or a set of activities, while implementation science and research is really a field of study that involves researching, understanding how to improve implementation over time. In essence, implementation is the what, and implementation science involves learning how to do this better in the future. Defining scaling up with language from implementation science: deliberate efforts to increase the impact of successfully tested health innovations, programs or services so as to benefit more people and to foster policy and program development on a lasting or sustainable basis. It's a guided process in most instances, or should be, and if you go to the GACD website, www.gacd.org, you can see examples of many of the scale-up projects and research projects that have been funded by the health and medical research funding agencies that support the research of GACD. And you can see the broad array of programs and innovations that are being taken to scale, but also the diverse range of methods and approaches that are being used to conduct that research, to undertake scale-up science, etc. Successfully tested refers to the fact that before taking a program or innovation to scale, there should already be some evidence for its effectiveness, efficacy, and ideally support for scale-up in the same or similar communities where the scale-up program is going to be undertaken. The health innovations are defined as existing services, components, practices, or products or innovations, or a set of innovations, interventions, which are often called a scalable unit. Lasting basis refers to the fact that for scale up to be lasting or sustainable, this typically requires support of institutions, support of stakeholders, support of professional associations, support from communities, etc., and buy-in for the innovation or program that's been widely implemented or taken to scale, and that there are going to be initiatives and support for capacity strengthening and for long-term sustainability. Scale up versus studying or studying scale up or research about scale up. The process of expanding a successful program or intervention to a larger scale is what's referred to scale up. The scale up science, as I've already indicated, is the study of and the research about the methods and the strategies to do this and to expand a program which has already been demonstrated to be efficacious or effective in communities, similar populations and services, and researching more about how to take this to a scale and how this can be done in a sustainable fashion. The focus of scale up is on increasing the size or reach of a program, and the focus of the scale up science is to understand the factors that influence scale up and to develop effective strategies to overcome barriers and challenges. The scope for scale up is a specific action or range of activities, and the scale up science is the package of research strategies and measures and study approaches which are going to be used to research the wider implementation of scale up. The goal of scale up is to increase reach and impact. The goal of scale up science is to ensure that the aspirations for reach and the impact of the program that these can actually be achieved and hopefully maintained longer term. The similarities between implementation science and scale-up science, well, they both focus on improving health outcomes. They both consider contextual factors, albeit for our hybrid kinds of trials, establishing the effectiveness of innovations and programs in low middle income countries and constrained or settings with constrained resources are often considering contextual factors at a more local level, while for scale up this can often involve consideration of factors which are at a more institutional or could be at a more societal level or in the broader ecosystem. But both implementation science and scale-up science are scientific endeavours to improve implementation, either in a very focused way or more broadly in terms of scale-up. Be useful for you to think about what other similarities there are between implementation science and scale-up science, and what are some of the similarities consistent across are there similarities consistent across populations, conditions, and contexts? What about the differences? In terms of scope, implementation science focuses on and typically focuses on the earlier adoption and use of an intervention in a particular setting or population, while scale-up science is typically focusing on the expansion of an already established successful intervention or program at a larger scale to reach more people, to cover wider geographic areas, etc. For the emphasis of both, implementation science is typically emphasizing factors that influence the successful adoption and use of an intervention within particular services and communities, while scale-up science is very often looking at factors that influence broader and more successful expansion of an intervention or program. The challenges faced in implementation science often relate to overcoming barriers to adoption and use in specific settings and services, such as lack of awareness, lack of resources, resistance to change, etc. The challenges faced in scale-up science often relate to issues about fidelity of the original intervention and its adaptation in different populations and communities, adapting to the new context, and ensuring sustainability at the larger scale, which then brings into play political considerations, broader factors in the community, competing funding priorities, etc. You might also like to consider what other differences there might be between implementation science and scale-up science, and are there differences which are more ontological, epistemological, theoretical, methodological, and other ones which will be discussed in more detail throughout the rest of this program. The other point I'd like to make is that in thinking about scale-up science, it's also helpful to look at it through other lenses. So can complexity science help us understand what other factors are influencing dynamic changes in systems? Are there ways in which systems can adopt and incorporate new innovations and programs? How might more social science approaches help us understand how different actors in the system, other stakeholders, communities and populations, how they might think about a new innovation and their preparedness to incorporate new practices and programs into their services and other activities that they're involved with. It's also useful to think about diffusion of innovations and other kinds of program models that talk about the sometimes opportunistic and other kinds of spread of programs and innovations. And we see this very often with diffusion of different technologies, for example, that this spread can be influenced by factors which are beyond the control of researchers and other actors in the systems. What are some of the other relevant concepts and considerations from implementation science? Theories, and how to choose relevant theories, models, and frameworks, TMFs, to inform scale-up science and research, how to assess and address all the different contextual factors and enablers and barriers that may influence the success or otherwise of scale-up in different settings, populations, services, etc. The critical role of engaging all different kinds of stakeholders throughout the planning and implementation process for scale-up. Fidelity, what are the sort of core features of a program or a service delivery model which are core and which need to ideally be adopted more broadly as part of the scale-up process in different settings and services, but which features of program delivery might be more adaptable and indeed should be adapted in order to enhance the likelihood of scalability. So these are sort of broader research questions that can be studied. Sustainability, the strategies for ensuring the long-term sustainability of scaled-up interventions. These include financial factors, human resource factors, organisational resources, a broader range of factors and influences than we often consider, that we often don't consider so deeply with more focused hybrid implementation trials, for example, but they are going to be important for sustainability of broader scale up across population services. The evaluation plans and methods and measurement strategies to monitor progress, assess impact, and identify areas for improvement during scale up. These need to be understood more clearly when we're also and maybe different to the sorts of methods and approaches and study designs we've used in our more classical implementation science research and hybrid trials. So each of these points will be discussed and considered in more detail in following lectures, and also will be discussed when we get together for the in-person program in India in the coming months. So further considerations, implementation science primarily focuses on the success, or very often or typically focuses on the successful adoption and use of interventions within specific settings, and may not provide direct guidance for large-scale population-level interventions. We often talk as if these are the same contextual factors and influences, but very often they be. Scale-up science aims to expand successful interventions to a large population, but the reality is often they take place and scale-up is undertaken without prior rigorous testing of the intervention's effectiveness, and we often don't have much evidence for scale-up at all. Scale-up decisions are often influenced by political factors, policy priorities, and the available resources, rather than by an evidence-driven approach. Implementation science methods are not always suitable for the rapid scale-up required in some situations. So, for example, with the COVID pandemic a few years ago, there was a lot of scale-up happening which was not directly informed by evidence, and definitely not evidence which was necessarily so relevant to that setting and context. And often the evidence was being tenuously extrapolated from very different settings and populations and contexts. So key messages from this lecture: scale-up science is the study of the methods and strategies to effectively expand successful programs or interventions to a larger scale. There's often a very blurred boundary between implementation science and scale-up science, and there is much more need for further research within implementation science to address the challenges of rapid scale-up and to develop more flexible approaches that can accommodate the realities of real-world situations, and particularly real-world situations in resource-constrained settings and in non-high-income country settings. So thanks very much for listening to and watching this lecture, and I'm very much looking forward to having a lot more contact and interaction with you in the future. Thank you very much.